Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the metabolic complications, first we have iron deficiency anemia. Iron deficiency anemia, more than 30% of patients who are undergoing gastrectomy will suffer from iron deficiency anemia. So it is seen in patients in more than 30% of gastrectomy. What are the causes for iron deficiency anemia? Iron deficiency anemia can occur due to decreased iron intake, and it can occur due to impaired iron absorption, and it can also occur due to chronic blood loss. In the gastrectomy or during peptic ulcer, there will be blood loss, or there is decreased iron intake, or there is impaired iron absorption. All these will result in iron deficiency anemia in the patient. So how are you going to treat the iron deficiency anemia? Iron deficiency anemia in the patient is treated by the addition of iron supplementation in the diets will help us in the treatment of iron deficiency anemia.
thank you and thank you for watching.